The following segment of Daytime Buffalo is sponsored by the Health Foundation for Western and Central New York. We know that Buffalo is the city of good neighbors, and part of what makes that aspect of our community so special is the work of all of our local nonprofit organizations and their partnerships. Joining me now with more details on how their two organizations are partnering up are Nora from the Health Foundation for Western and Central New York and Elizabeth from Endeavor Health Services. Welcome, ladies. Thanks so much for joining me.
Thank you.
Thank you.
I'd love it if you could start off by telling us about each of your different organizations and how you work to improve the health and wellness of our community. Do you want to start, Elizabeth?
Yes, thank you. So Endeavor Health Services, we are a certified community behavioral health clinic. Another way to think of it is a community mental health center. So we focus on all things to do with mental health, substance use, community supports, primary care screening, and all sorts of supportive services as well as care coordination that go along in that whole kind of scope.
Okay, all righty. And what about you,
And the
Nora?
Health Foundation for Western and Central New York, it's a charity, it's a foundation. So we have an endowment and we do grant making to community-based organizations in the community, to nonprofit organizations such as Endeavor, in order to help the most vulnerable in our community, children, older adults, caregivers, and pregnant people, to make sure that they have access to quality health care.
How vital are nonprofits to our community's social fabric, especially with the work that each of your organizations do?
To me, I mean, we take on and we do provide the bulk of community support services as well as healthcare services. We're very regulated. We all use evidence-based services, have quality outcomes and measures. And so the sophistication and the breadth of what the nonprofit sector does in healthcare as well as community support, it's probably like incalculable, really, when you think about it. But, you know, on average last year we did 91,000 visits.
Wow.
As well as walk-in. So that's a lot, you know, and that's just in the mental health and substance use as well as community support realm. So everything from linking folks to, you know, food support, housing, transportation, primary care, as well as providing services directly ourselves. We do it all.
Can you tell us how this partnership came to be and why it is so symbiotic, your relationship?
Yes, so the Health Foundation, any foundation, we must give money to a nonprofit organization. That's the IRS rules. So all foundations are dependent upon the nonprofit sector, just as they are dependent upon philanthropic dollars.
Right.
So that's our partnership. So the Health Foundation will provide grants in order for organizations such as Endeavor to be able to provide the necessary services, to build up the workforce, to do training, and to make sure that they're providing appropriate services in the community. And so, and we're lucky to have Liz on our board.
Makes sense. Okay. So let's talk about some challenges that nonprofits are facing right now.
Okay. Staffing, everyone's right, everyone's talking about staffing. It is difficult in the nonprofit sector to compete for staff sometimes against either for-profit or government entities, things like that, just in terms of salary and benefits. It's just very difficult to compete. What we offset that with is amazing missions, you know, just very inspiring work, great teamwork and all of that. The other really big challenge is funding uncertainty. You know, we literally all just lived through, you wake up in the morning at 6 in the morning and you got an email at 12:02 that your funding was cut for 2 major grants.
Right.
And then less than 24 hours later it was reinstated. That's really difficult for folks to navigate. It creates panic and uncertainty. So those are probably just some of the real big ones, funding and people.
Yes.
Yeah.
You know, two biggest things, right? You can't help the
right.
people without the fund.
Right.
So without the help of local nonprofits, how do you think our community would be impacted, and what are those resources that are at risk of being lost?
To me, we would see, so without the nonprofits, because again, we're carrying such a load, we're doing such a big, huge part of the services. So I think we would see folks losing their community-based services, all the preventive, all the supportive, which would mean conditions or problems would escalate to now it is all crisis.
Right.
Things that could have been avoided. So this is where now your hospitals and your inpatient and your school systems, everything starts to get overwhelmed,
right,
because all those other supportive services that are helping support a child in school, helping a parent with find childcare, you know, helping people have food security or housing, all that. So increased homelessness, increased, sad to say, overdoses, suicide.
Mm-hmm. it's a vital role that both of your organizations are playing in our community. So thank you so much for the great work that you do, and thank you for sharing more about it. Viewers, if you'd like to learn more ways to support nonprofit organizations like the Health Foundation of Western and Central New York and Endeavor Health Services, visit supportwnynonprofits.org. This segment is sponsored by the Health Foundation of Western and Central New York. And thanks again for coming in, ladies.
Thank you.
Thank you for having us.